All right, welcome everybody. It is time for Health Talk. I am Peter Christian. That's the one and only John King over there. Good morning, John.
Hey, good morning, Peter.
Can you hear anything? You okay?
There we go.
You got
I
it?
can hear myself.
Okay. All right, now you go. Okay, so welcome to Health Talk, everybody. And we do this every Monday. It's brought to you by our friends at Community Medical Center. Joining us right now is Greg Salisbury. And as soon as I saw this title, I thought, this is like Flash Gordon stuff, you know? So, of course, I'm Flash Gordon. Everybody else is Star Wars and, all that kind of stuff. Or Buck Rogers in the 21st century or whatever. So first of all, this is a really very serious subject, but when I saw the term hyperbaric, I thought, oh, wow, that's really scientific. So tell us what it is you do over at Community.
Yeah, we're very excited about it. I mean, we've been doing wound care for a long time, but just recently added this new technology. And it's technology where we treat with 100% pure oxygen, and we place someone in a total body chamber, and we can help the body optimize its ability to heal chronic and unhealing wounds.
Now, tell me a little bit about the genesis of this technology, because we've heard about this before in various news stories, but didn't know we had one here in Missoula. So, what's it all about?
Yeah, it's the first one of its kind in Missoula and in the area, so we're very excited about that. It offers a new option for anyone who's got a non-healing wound, so that's great. The genesis, I actually was involved with the request process, and we've pitched it to our leadership at Community Medical Center, and they thought it was a great idea and jumped on board, and so here we are with this option for people in Missoula.
What exactly does it do?
So it pumps 100% pure oxygen into a chamber and then pressurizes that to up to 2 or 3 times atmospheric pressure that we live in right here. So it allows the body to be in a 100% pure oxygen environment, and many wounds are caused by a lack of oxygen. So it can help heal those wounds by just optimizing the body's own process.
So when you say a non-healing wound, what circumstances lead to that problem?
Great question. So it could be anything from a diabetic wound. When you have diabetes, and over 9% of America's population have diabetes, so it's a huge issue, and they're much more likely to have a wound because of their ability to process sugars and heal wounds. And then it also is oftentimes related to arterial flow to a wound to help heal a natural wound that you and I might have a scratch or a sore. If you can get good flow to that wound, and you've got good arterial flow, then you'll heal that wound. But if you don't, this technique can purify oxygen to that wound and then help feed the wound to heal it.
What is it about diabetes? I know diabetes it's a terrible disease, and it does all sorts of horrible things to the body, from the eyes to the feet to the hands, whatever. What is it specifically about diabetes that simply won't allow a wound to heal?
There's a couple things, sometimes without getting too deep into it, but the enzymatic reactions to cells are impaired, and sometimes it's if you don't take care of the sugar levels, and some people are dependent on insulin, some people manage their diabetes with diet, and part of the thing we're doing also in this wound center is educating patients with diabetes. How can you change your diet, or how can you incorporate exercise to keep your sugar levels healthy at a healthy level, to then avoid wounds or help heal your wounds naturally.
Okay. Now, when you're in the hyperbaric chamber, lots of wounds are on the outside, right? Superficial, maybe is a good word to say. But there's others, maybe you've got wounds inside. What about stomach ulcers, things like that? Could this help that?
It's not necessarily indicated for stomach ulcers, but what it helps with ideally is bone infections. Bone infections called osteomyelitis are very hard to heal. A lot of times patients have to undergo months of IV antibiotics, and it's very expensive, and it's very difficult to heal, and it's very risky. A lot of amputations happen because of a bone infection, and this is perfect for a bone infection. It's one of the indications.
How did they discover the hyperbaric chamber's effect on this? I mean, was it kind of accidental, kind of like penicillin was an accident, or what?
They've been doing this in Europe for a long, long time, and they've been doing it in the United States for a long, long time. But it was discovered by someone who, they used to use it on animals, actually, and there are some centers around the country that do this on animals. There's a horse chamber and a dog chamber, but it's like anything else.
A big chamber.
It must have been. But it was experimental, and then they did lots of studies, and it's FDA approved, of course, so it's safe, but it's like anything else. It was experimental. Someone came up with an idea, And really, it's basic science. You need oxygen to heal wounds. So we know that as medical professionals. And so someone thought, how do we get more oxygen to a wound? What better than 100% pure oxygen that's pressurized to get that oxygen in your entire body?
So, I mean, if you like wrapped my bag up in a Ziploc bag, like my foot, I got a wound on my foot, put a Ziploc bag over and pump oxygen in there, would it have the same effect? Or do you need like the pressure?
In a word, no.
Okay.
But there are some chambers like that. There are some that just treat
It's a
the arm.
do-it-yourself chamber, John.
Well, and there are some that just you can put just an arm into. And there's certain benefits to that. But if you can get the whole person in there, then you're breathing this in, and then it's going from your lungs to perfuse to those body areas.
Now, when you say it's pressurized, what scares me a little bit is my mom was a scuba diver, and she experienced a little problem with the bends at one point and had to be put in one of these chambers in order to get back to normal. Is this the same type of thing?
It's very much the same.
Is it?
Yes.
Okay.
And the pressurized thing, we take people from our normal atmospheric pressure down to this 2 atmospheric pressures or whatever the doctor indicates very slowly. So you barely, it's just like going up in an airplane and your ears pop, but you're in a pressurized cabin, just like that.
Okay. So it's so it's totally safe, right?
Totally safe.
Okay.
Totally safe.
Well, can you
You're
make
going
it
in the
not
tube,
safe?
man.
Like,
I don't want to.
can you turn up the volume on the pressure?
We will not be doing that.
It's like I'm going in the tubes, man.
So when someone crawls inside of it, you always see in the movies where people are getting like a scan or whatever, and they shove them in the little white hermetically sealed box, and then the lasers fly around, and it's kind of scary, right? Is that kind of what a hyperbaric
Actually,
is like?
so I've laid in this thing, and we didn't turn it on, but I wanted to see what it was like. So I got inside, and it's all glass. It's all glass. So it's just like being in like the cab of a truck where you've got a windshield and windows to the side. You don't feel like you're in a little confined area. You're seeing out.
So it's not claustrophobic.
No.
Oh, okay.
No.
Good.
And if someone was a little bit of medication, and it's all good.
Okay, we're going to take a break. If you have a question about this, Greg Salisbury, he's the program director for the Wound Healing and Hyperbaric Center. I want to talk about the center itself and all the other things that you guys do there. We have 4 lines open. If you want to visit with Greg, this is pretty cool technology.
This is really cutting edge stuff. Hyperbaric isn't even picked up by my Facebook spell checker. So
Really?
we're very cutting edge.
All
I
right.
like to say hyperbolic.
We're going to come right back. Back on Health Talk, 721-1290 is our number, 1-800-568-5309. Talking with Greg Salisbury, Program Director at the Community Medical Center's Wound Healing and Hyperbaric Center.
Yeah, well, real quick. So when I was a kid, I had a friend, and he had, I think it's hemophilia, where the blood won't clot. Would a hyperbaric chamber at all help with a situation like that? Or?
Not like that. And there's very specific indications for the hyperbaric chamber. We follow those 100%. We don't do anything off label. Everything's evidence based, so we're not guessing on what we think is right. We're going off of evidence to only treat patients where the studies show that it helps.
And the majority of the people that you get in there are dealing with diabetes?
I don't know about the majority. So besides the hyperbaric medicine, we treat all wounds. So we see wounds that are pressure ulcers from maybe a patient that has a spinal cord injury or a venous wound. Venous wounds are incredibly prevalent. In fact, more than 2 million Americans have a venous wound right now. So
Now, you might want to describe what that is.
Okay, so
venous means vein.
Yeah, so
veins, right?
So the arteries bring blood to the tissue, and the veins bring blood back to the lungs. Okay, and so when you've got a venous insufficiency, you ever see like varicose veins or spider veins? That's a vein that has failed, and the smooth muscle around that vein has failed, so that it's enlarging, and then you have poor ability to have your blood return back to the heart and subsequently to the lungs. So if you've got that poor venous return, like, and one example is the spider veins or varicose veins. So that can lead to a poor perfusion for an area and then a chronic wound. And people get these wounds where they just sort of appear and then they can't get rid of them.
Right. And so the center itself, it's all about wound care. Now, I had a dear friend who was diabetic and stubbed his toe and tried to tough it out, being a tough guy, and did not care for the wound, and all sorts of horrible things happened. including a hospital stay that ran into the months, and some really bad surgeries and things like that. So, in a situation like that, is quick action really necessary to make sure that you guys catch it early?
Absolutely, especially with something. Another thing with diabetes, you ask why do they have wounds and non-healing? They have neuropathy, which means they can't feel as good as anyone else. And so sometimes they'll stub their toe and not think anything of it, and then they look 2 days later and they've got a great big gash. The other thing is they have trouble fighting off infection. And so if they do get a wound, they can get infected sooner than other people, and then it can go to the bone, and then it could lead to an amputation. So soon action is incredibly important. And that's something we specialize in. We unfortunately, we tend to see patients with chronic wounds or infected wounds, and that's what we specialize in. But quick action would be better to prevent that infection.
So what would you suggest to people who are, if you have this problem, you know it, okay? So is self-knowledge really important here, and not to say I'm going to be a rugged Montana guy or gal, I'll get to it later, that sort of thing, I'm too busy right now. None of that counts, right?
Yeah, it's super important to have good health care, and it's a holistic approach. I mean, you need to have a primary care physician that's helping you manage your blood sugars, and then you need to be educated on diet and exercise and what is diabetes and how does that potentially put you at greater risk for a non-healing wound.
We have a post from JR. He says, I recently lost a family member a few months, and the doctor never even considered hyperbaric therapy for my family member that had a bone infection that later killed her in October. Is this something that most medical professionals know about, or is it kind of so new that it's not quite hit all of the offices?
The technology is not new, but the availability in Missoula is new. We've only been open since mid-November.
Wow.
We're just brand new with this, but that's why we're so excited to bring it to Missoula, because it could help people where we previously didn't have the option.
Now, when I was looking at the sheet you were kind enough to share with us, it talks about skin substitutes. Now, what's that all about?
It's also something really exciting, cutting edge that we're doing at our wound center. And if you've got a non-healing wound, we're getting to the level of the tissue makeup of that wound. So is there a bacteria in there or some kind of a bug like you've heard of MRSA or staph infections? But we also get down to the level of why is this wound not healing? So a wound heals with collagen, building collagen in what's called an extracellular matrix. And all that means is like a scaffold that builds a wound back up from a deep wound to like a shallow wound and eventually skins over. Why is that not happening? We get to this cellular level, and these skin substitutes are there's lots of them out there, but ones we're using are sometimes they're human derived, sometimes they're derived from fetal bovine tissue.
How do you derive the skin sample from the human? You're like, pardon me, sir.
If you really want to know,
if
you really want to know, they take tissue samples from babies' foreskins, which still have stem cells. And so they process this in a plant in New Jersey. It's all FDA approved. This is nothing off-label. And they use that with stem cells to create these skin substitutes to then help heal a wound.
Aside from the half an hour of humor that could go with that, which we don't do, we do have a caller. So strap those headphones on, and let's get Tom on the line. There you go. Grab those right there. Tom, you're on. Whoops, there you go. Tom, you are on with Greg Salisbury. Go ahead, sir.
Good morning. You're talking about stub toes and so on with diabetes. My son is 15. Has had diabetes since he was 4, and in the past year or so, he has taken up skateboarding, and he's good at it. But he gets battle scars, and he is known to stub his toe. I haven't seen any indication of, terrible, progression from any of his wounds. Is a younger person less likely to get, the wounds you're talking about? How they progress into something terrible, or?
Yeah, the short answer is yes. The younger,
it would kill him to stop skateboarding. It really, he loves it and he's good at it.
Well, first let me just plug there. Hopefully he's wearing a helmet and all that protective gear. But skateboarding's awesome. I wouldn't tell him to stop. There's obvious risks involved with skateboarding.
Next time.
Younger people are less likely. Their bodies are more healthy. Unfortunately, as he gets older, it's just going to be very important that he's paying attention to his sugar levels, and his doctor, I'm sure, is going to be up on that. But it's just the older he gets, the more important it is for him to have good health care as well as education on what does that mean for him as he gets older, and what does his diet what does he have to pay attention to diet-wise and exercise-wise.
Let's see. We got a question from Claire. She says, do the antibiotics given to the livestock we eat, milk we drink, impede our ability to fight infections and self-healing?
I don't know. I mean, that's a I don't know.
All right. Well, Courtney also wants to know, can this be used to treat Lyme disease?
No, it's not indicated for Lyme disease, unfortunately. And this goes. So the primary things this will treat is for non-healing diabetic wounds that have to be, and we scale them. So diabetic wounds are one. Wounds that have a bone infection is two. Another option is arterial insufficiency, where the wound does not have good flow. Those are the primary things. The other thing that it's indicated for is if you've ever had radiation from a cancer treatment, that can dramatically change the cellular makeup of your tissue. And then if you get a wound there, it won't heal for years. So they call it tissue radionecrosis from radiation. And that's another indication for this is if you've ever had radiation on a jaw or on a body part and then you have a non-healing wound, this is a therapy that can be dramatically helpful.
We're up against another break. 721-1290 is the number. We're learning a lot here, and we really appreciate Greg stopping by. Greg Salisbury, Program Director for Community Medical Center's Wound Healing and Hyperbaric Center. We have a few precious minutes left. If you have a question or comment, give us a call, and Greg will be happy to answer it if he knows. Because sometimes he says, I don't know, which is very refreshing. So we're going to come right back in a moment. Okay, we're back, and this is Health Talk. We're talking with Greg Salisbury, he, of course, Community Medical Center's Director for Community, the Wound Healing and Hyperbaric Center. Now, there was one extra thing you wanted to talk about, Greg, that we hadn't gotten to yet, so go ahead.
Yeah, the other thing this works great for is any failed or compromised skin graft. So if you have a full thickness skin graft and it's not taking, not healing, if we get to you immediately within the first week, before it's failed, this can have a dramatic impact on the success rate of skin grafts.
When you're putting people in these chambers, are they just getting? Is their body better at doing its own thing, or are you adding stuff to it?
Basically, the body has optimized its own healing potential.
Okay, and I love that Scripture says we're fearfully and wonderfully made. And we do have that wonderful ability if things are, if all the conditions are right, a wound will heal. But sometimes you have to give it a little bit of an assist.
Exactly. And this is that assist.
All right. Well, let's get Mark on the line. Grab your headphones there. And we got about 2 minutes. So, Mark, quickly, what's your question?
Oh, my question is, for diabetics, I've heard, but I'd like to hear from an expert, that they have a lot of injuries when they do their own toenail clipping. Is that true, or is that just a...
It is true, and what I'd recommend is go see a podiatrist to have those toenail clippings done. They're very good at it. It's covered by your insurance, and it's a very good idea to have a podiatrist do that.
Yes, because you can injure yourself and not know it.
Yes.
Okay, Mark, thanks.
Okay, thank you.
Thanks for the call. Okay, we have about a minute and a half left here. So give us some information on where you're located, how to contact you. Is there a website, and where we can get just more general information before we need to know if you're the guy to call.
You bet. We're right on Community Medical Center campus. We're a Community Medical Center program, and we're on the west side, closest to the soccer fields. If you know where the brand new oncology center is, we're right in front of that. We're a beautifully newly remodeled building with new equipment, new chairs, these new hyperbaric chambers, and our phone number is 327-4514.
And the really cool thing is there's all that free parking there, too.
Yeah.
You have to worry about parking meters
parking
or any of
great.
that jazz. Yes, it's really exciting. So in the 1 minute left, who would you say is most going to be interested in this particular type of program?
Anyone with diabetes or anyone with a non-healing wound or anyone that has even questions, you give us a call. We're happy to talk to you. Our website is the community www.communitymed.org. Come onto our website too, and we're on there as well.
Great. It's been a pleasure.
Thank you.
Thanks. Yeah. So anybody with who has a friend or a family member who's diabetic or struggling with like cancer care, that sort of thing, has a wound that doesn't heal, you're right there.
Yes, we're
Awesome.
happy to help.
Greg, thanks so much.
Thank you, guys.
Appreciate you being with us. And we have Talkback coming up, John. So who's coming up at 9?
Yeah, Majority Leader Ron Eli will be on from the Montana Legislature.
All right. So we have lots more coming up on our 1-hour version of Talkback, which is coming up in just a moment. Stay with us.